Joining me now from Washington, D.C. is Health and Human Services Secretary Dr. Tom Price. Mr. Secretary, good to see you. How is your department helping out with the recovery and relief efforts? I know that healthcare teams were being sent into the region even ahead of the storm.
Yeah, with the presidential declaration of an emergency and with the public health emergency that we declared for the Virgin Islands and for Florida and Georgia and South Carolina, we were able then to pre-deploy, get folks on the ground in the area so that we're able to respond as rapidly as possible. HHS, Health and Human Services itself, has over 600 individuals on the ground right now carrying out the kind of treatment needs that are necessary, healthcare needs that are necessary in the missions, as well as evaluating the hospitals and making certain that we can get those hospitals back up and online, especially in the Keys and in South Florida, as rapidly as possible.
Secretary, talk about some of the health risks that will be apparent in Florida after this storm moves through, but particularly what you've seen after Hurricane Harvey in Texas, for example, things that people need to be on top of when dealing with their own health care.
Yeah, in the acute phase, it's making certain that you're able to care for and take care of the acute needs that folks have. So one of the things that folks oftentimes don't think about is that there are many individuals that are actually dependent on power, dependent on electricity to survive. So whether you're a dialysis patient trying to get to dialysis, whether you're an individual who uses an oxygen concentrator that requires energy, or an electric wheelchair, or those kinds of things, then we need to make certain that we have, and HHS has, the list of all of those individuals. We know who those folks are and where they live, and we are able to share that through our Empower data with the local communities, so that the local folks can actually go knock on the door and make certain that people are all right. That's helped incredibly well in the Virgin Islands, on St. John and St. Thomas, where there were over 130 individuals who were dialysis dependent. When the power went down in St. John and St. Thomas, they weren't able to get their dialysis, so we were able to get them evacuated to Puerto Rico and be able to provide them with the dialysis services and literally save their lives.
This is great government involvement in people's health and dealing with these catastrophes, but let's talk about a different type of government involvement in people's health care. We have New York Senator Kirsten Gillibrand, pardon me, now joining a growing list of Democrats who are co-sponsoring Vermont Senator Bernie Sanders' Medicare for All bill. Sanders is expected to unveil the measure tomorrow. Secretary Price, does this have any chance of ever passing?
Well, I would hope not, and I think that the vast majority of the American people would hope not. And it's not because we don't think folks ought to have health care. We do. It's important, though, that health care be patient-centered and not government-centered. The problem with a single-payer system is that the individual, the entity making the decisions about what kind of health care you receive or whether you receive health care is the federal government. And I would hope that individuals wouldn't sense that that's the direction that we need to go. The direction we need to go in, as I suspect most of your listeners believe, is in the direction of patient-centered care, where patients and families and doctors are the ones making medical decisions, not Washington, D.C.
I can play devil's advocate, though, because seniors who are on Medicare, for the most part, like Medicare, and it's single payer. The problem is that nowadays people are taking out more in terms than what they paid in, and you have, according to the government, Medicare is going to go broke in 12 years. There's roughly a $50 trillion hole in Medicare. That's the problem. But if people like it, that's how the Democrats are going to be selling it. It's like, oh, we're just going to take a little bit of money out of your paycheck every month, and we're going to handle your health care for you. That's the sales game.
No, you're absolutely right. But the problem is that, as you noted, there are some challenges in Medicare. Again, all of us want everybody to have health care and health coverage. But in Medicare, there are 1 out of 8 physicians in this nation who ought to be seeing Medicare patients who don't, because of the rules and the regulations through Medicare. There are narrowing of networks, so individuals, if you're a new senior, even in metropolitan areas right now, if you turn 65 and the doctor that you had doesn't take Medicare, and you try to find a new physician taking new Medicare patients, it's almost impossible to do so. And it's not because they've forgotten how to care for people. It's because the system itself bogs them down and makes it so it's much more difficult for them to care for folks. So the alternative isn't just government and isn't just insurance companies. It's a direction that we believe is most appropriate, the President believes most appropriate, and that's where patients and families and doctors are in charge of their health care and their health coverage.
Mr. Secretary, you guys got to do something about fixing Obamacare, and now it seems like the ball has been handed off to tax reform. What's the time frame that you're looking at? Because there's certainly movement in Congress to try and still advance something on repeal and replace.
Well, it takes an act of Congress to move us in the right direction on health care, and sadly, we haven't seen that act of Congress yet. So what we continue to challenge folks to do in the House and the Senate, the House passed a bill. Senate needs to pay attention and make sure that they're able to pass a bill as well. It doesn't look promising in the near term, but what our challenge is, what our job is, our mission is at Health and Human Services is to make certain that every American has access to the kind of coverage that they want. And so what we're trying to do is to make certain that we relieve the burden of individuals from Obamacare, that we allow for states to have greater flexibility. Those are the kinds of principles that we believe in, that the President believes in, that will actually improve the health care system. But repeal and replace is an absolute necessity because we're moving in the wrong direction. Prices are going up, deductibles are going up, care is going down. Many individuals have an insurance card, but they don't have care because they can't afford the deductible that insurance card requires of them. So the status quo right now is not good, and it's a complete direct result of the previous system of Obamacare and the Affordable Care Act.
Secretary Price, good to see you. Tom
Thanks,
Price,
Megan.
Secretary of Health and Human Services. Take care.